Hello everyone, I am Nafisha Parveen and our today's topic is constipation. I hope you all are familiar with this topic. It refers to hard stools and painful defecation. Now, here is the definition of constipation. Constipation is the passage of firm or hard pellet like stools at infrequent and long intervals with difficulty to expel or a sense of incomplete emptying after a bowel movement. Infants who are formula fed have more chances of getting constipation than breastfed infants. In young child, constipation is sometimes due to emotional upset arising out of conflict with the mother over toilet training. And in older children, the cause of constipation is similar to the adult. The problem of constipation occurs in all age groups, but it is almost epidemic in the case of older adults. Here are the causes of constipation. First, lack of fiber in the diet. Fiber is important in maintaining a soft, bulky stool. Diets that are low in fiber can therefore cause constipation. People those generally used to take refined cereal, fruit juices instead of whole fruits and vegetable diet suffer from constipation. Next, faulty dietary habits, inadequate amount of fluid or water intake, lack of exercise, excessive use of laxatives, use of certain drugs as analgesics and antacids, diabetes mellitus, intestinal obstruction, colonic inertia, which is a condition in which the nerves or muscles of the colon do not work normally, and as a result, the contents of the colon are not propelled. Next cause is pelvic floor dysfunction. It refers to a condition in which the muscles of the lower pelvis that surround the rectum do not work normally, and these muscles are critical for our defecation. Next cause is hormonal imbalance. Hormones can affect bowel movements. For example, too little thyroid hormone or hypothyroidism and too much parathyroid hormone by raising the calcium levels in the blood can cause constipation. During menstrual periods, estrogen and progesterone levels are high and may cause constipation. High levels of estrogen and progesterone hormone during pregnancy also can cause constipation. Next cause is central nervous system diseases. Some diseases of the brain and spinal cord may cause constipation, including Parkinson's disease, multiple sclerosis, and spinal cord injuries. Fatigue, worry, anxiety may cause stress, and this stress in turn leads to constipation. So, these are the causes of constipation. When there is insufficient emptying of the bowel, this may lead to malaise, headache, coated tongue, foul breath, lack of appetite, and these symptoms usually disappear after satisfactory evacuation has taken place. Now, complications of constipation. Complications of constipation are rare, but long term or chronic constipation may have the risk of following: anal fissure. In some cases, bleeding is the result of a small tear around the anus. Next complication is piles, rectal bleeding, inguinal hernia, swelling of the rectum, bowel incontinence, prolapse of the rectum. The distension of the bowels with accumulation of feces may produce headache and apathy, dangerous for the patient of coronary heart diseases. Now, what are the management of diet in the case of constipation? Diet plays a very crucial role in the treatment of constipation. Intake of high fiber foods should be increased by eating whole cereals, whole legumes, nuts, edible seeds, and increasing consumption of green leafy vegetables in the form of salad, example radish, carrots, cucumber, onion. They may be added to the diet. Fresh fruits, for example, guava, apple, pear, papaya, oranges, should be given. And brown and powdered fiber supplements may be helpful in persons who cannot eat sufficient amounts of fibrous foods. If chronic constipation persists, however, then agents that increase stool bulk may be necessary. These bulking agents include bran or more soluble forms of fiber. Fat containing foods such as bacon, butter, cream, and oils are useful for some because of the stimulating effect of the fatty acids on the mucous membranes and act as lubricant and cause evacuation of the bowel. Those who suffer from constipation should drink more water. Intake of 8 to 10 glasses per day is useful. Some individuals find that 1 or 2 glasses of hot or cold water, plain or with lemon, are helpful in initiating peristalsis when taken before breakfast. Taking laxatives or enemas on a regular basis should be avoided in constipation. So we are done with our topic constipation. Thank you.